Good day. My name is Egozcue-Ochoa, and I am here to discuss with you my interest in the manager of nursing education. I have 15 years of experience as a nurse, and 10 of those have been in education. I've had the privilege to work in individual departments as well as at a corporate level. I am currently working in a corporate position where I am serving nurse residents throughout the healthcare system. In preparation for this role as manager of nursing education, I delved into the multi-factor leadership questionnaire. I wanted to find out truly what my educational leadership skills, where my strengths were, and where were my opportunities, and reveal the true self. So for me, I found that it validated my self-evaluation, that I am a transformational leader. I value respect, faith, and trust. I have been one who has been known to connect well with others throughout the healthcare system, and I truly appreciate finding a common ground. In my former roles, I've been known to round on clinical staff, leaders, and educators alike. In rounding on my colleagues, I've also established working relationships that have developed over the years based on caring and compassion. Although we work in a clinical area, I always find common ground. What do I mean by that? I always ask people how they're doing. I ask them about their family, about their friends, about their interests, and I find ways to connect with them on a personal level. Allowing myself to connect with people on a personal level has opened doors and gained the trust of others. I enjoy leading others to a shared vision, which takes me back to the transformational leadership aspect. Currently, I've been working on a research project, and I thought of enlisting some colleagues which did not have experience in research. This was an opportunity for me to leverage their strengths and to also mentor them in the process of participating in leadership and in research. My colleagues and I meet now, we now meet weekly, and in meeting weekly, we are discussing our goals, we're setting clear objectives with deadlines, assuring that our city is completed in a timely manner, and every week there's a recap with action items. In conducting the recap, I take it as an opportunity to celebrate our victories and also the kudos for anybody who has taken an additional task on or has made or has found something new that we had not thought of before. We all work well in collaboration in this team setting, and we like to work together to find new solutions to old problems. I enjoy promoting learning across various settings. In my clinical work, I've been able to work at the bedside. I've also worked as the bedside educator. And as the bedside educator, I've been able to do just-in-time training, as well as rollouts and initiatives, and also conduct simulation in situ. In the role as the nurse manager, functioning as the nurse manager over education, my goal is to be able to inspire the nurse educators to have a personal connection with their staff. It's important that they participate in daily rounding with their staff to establish those connections and also to better understand their learning needs. We work with new hire nurses that are coming in from other facilities or other healthcare systems. This is an opportunity to introduce them to our clinical setting and also our policies, procedures, and how we do things according to the Baptist Health Way. Additionally, we work with new graduates in the clinical residency program. Our new graduate residency program is competency-based. So the learning is in part didactic, and the other part is also clinical time. We use this also as a learning opportunity for simulation in situ, which is in the clinical setting, as well as in a controlled environment to be able to give exposure to concepts which are high risk and low volume, giving our new graduates a sense of safety and security during their learning process. My nursing philosophy is very people-centered. I really enjoy working with people, collaborating with others. I excel as a leader, and I also participate well as a team, part of a team. I enjoy leveraging other people's strengths and finding areas where I can assist others, where there's area maybe of opportunities or rooms for improvement. I enjoy long-term working relationships, and over the years in the healthcare setting, I have built long-term relationships built on trust, care, and compassion. My colleagues know that I am reliable and dependable. Whatever is needed, they can count on me, and they know that I will always come through. In my role as nurse manager over education, I would like to develop nursing educators, promote learning across various settings. As mentioned before, the various settings are in the clinical setting. They are also in didactic for the nurse residency programs, and also in didactic for ongoing education throughout the healthcare system. I would like to also find ways that are creative to leverage our skills of our nurse educators. I enjoy creative opportunities to implement escape rooms, tabletop simulation, and gamification when possible. This has always proven to be a very popular way of implementing education and finding ways to meet the learning needs of a diverse group. One of my goals as nurse manager over education will be to foster interprofessional education. I find that it is important to improve communication throughout the healthcare system. Nursing is not siloed, and we work collaboratively in interdisciplinary teams. We also know that the number one cause of medical errors in the clinical setting is communication or poor communication or lack thereof. So I would like to implement interprofessional education initiatives, maybe in simulation where we could have PT, OT, speech, physicians, nurses, and other members of the healthcare team participating in activities that will improve communication. I enjoy also the education that happens, such as the learning at the bedside. In situ was one of the examples, but I also enjoy the just-in-time training. It's important that the nurse educators that I would work with understand that just-in-time training is really a valuable tool because at the bedside, next to the patients, in the clinical setting is really where you're able to put the concepts and theory connected with the actual skills. I would like to collaborate with the nurse educators to discover new ways to meet their learners' needs. And I also like to find out what is new in the clinical setting. So I like to connect with other healthcare systems and other entities and other departments to see what works well for them and what are areas or opportunities that we could implement within our own entity. As a manager of nurse as a nurse manager over education, I would like to develop my nurse educators, identify their interests, and find opportunities and areas where I can support them for growth and development. Professional nursing development is important to me. And as a part of professional development, I enjoy mentorship programs as well as attendance in conferences and seminars that are ways that we can learn from each other and grow in our profession. I would like to find ways to support the nurse educators in improving on areas such as research, performance improvement, quality improvement, accreditation, and nurse-sensitive indicators. These are all important roles of the nurse educator, especially those that are in the clinical setting to empower and support the nurses at the bedside. As part of the mentorship program that I would like to implement, I would like to identify common personality traits and common goals of nurse educators paired up with mentors that have the experience, same personality traits, and that have the experience and the goals of the nurse educators. I believe that mentorship across the system is beneficial because they belong to the same healthcare system, which has the same policies and procedures, yet you're being paired with somebody outside of your entity who may have a different perspective. So they can have the same role, but a greater experience and be able to mentor their mentees and support their professional growth and development. I thank you for taking the opportunity to get to know me as Alicia Egozcue-Ochoa, as an educator seeking a position for nurse manager in education. Thank you.